Hello, welcome everyone. Welcome to the Blueville Wellness Show. We're actually streaming live as well in the Blessed Mary Messages YouTube channel because I have a very, very special guest. I cannot gush enough about her. She's one of my people. As we were talking, we just like sat next to each other in Omaha in our NaPro training, and even the airport and the bus and like everywhere. I feel like the God really brought us together so we can send his messages. So again, I'm Cristy Murray. If this is your first time here, I'm a Catholic nurse practitioner. I'm a hormone health specialist and someone who believes that understanding your body is one of the most powerful things that you can do for yourself and your family. If you're watching live right now, welcome. And so drop a hello in the chat. Tell me where you're tuning from. And if you're catching the replay, I'm glad you found us. Like I said, I'm really glad we're making this happen. We're going to a territory that matters deeply to a lot of women in this community, the science of life. And we've been talking about perimenopause, but we need to kind of backtrack and go back to the foundations. So we're talking about what bodies are designed to do and what it looks like when faith and medicine actually work together instead of against each other. So stay with us. My guest today is Dr. Felicia Cummings. She's a board certified family medicine physician and board certified in obesity medicine. And she holds certification in NaProTechnology, which puts her in a relatively small and growing group of physicians in this country trained to offer women fertility care that works with the body rather than overriding it. And it's grounded in respect for life from the very beginning. Her practice is in Southern California, where she grew up, and she's a wife and a mother of 3 children. And I saw them all, they're beautiful babies. So recently, she stepped outside the clinic and into the world of publishing. She wrote and self published her first children's book. It's titled Loved Beyond Measure. If you want to understand who Dr. Cummings is, that title tells you a lot. So, Dr. Cummings, Felicia, I'm so glad you're here.
Hi, Chris.
Before, is there anything else that I forgot to say that you want to
Oh
say?
no, you did a wonderful job. I'm honored really to be here and talking with you today.
Uh, all right, so let's start with a little warm up. So, quick questions. What book are you reading right now, aside from your wonderful children's book?
Yes, well, a lot of children's books lately because my kids are 4, almost 3, and now 5 months old. So, but besides that, on my nightstand, I have a period repair manual by Laura Brydon. It's
Oh, I
a
have
book,
that book too.
yeah, by a naturopath, and I find that it just explains, women's hormones and birth control uh well. And so and then other than that, my spiritual book is, I have to look at it. Discernment of Spirits in Marriage. That's the other one that I have. And it's
Wow.
been really great. It talks about St. Ignatius's rules of like
Mm-hmm.
spiritual discernment. And so it's been helpful to me to kind of um,
Hmm.
follow God better, because I
Okay.
realize I can make the biggest impact if I'm on the right track myself.
Yeah, it's amazing. Always go back to the foundations, right?
Yeah.
So, what is the first thing that you do in the morning? It must be
Oh,
challenging with kids.
the first thing that I do in the morning, probably lately, has been my almost 3-year-old is often in our bed. He climbs in the middle of the night, and so he just hugs me first thing in the morning.
Oh.
Yeah, so it's pretty nice way to wake up, and then change the baby and
Mm-hmm.
get ready for the day. And then lately, um, I'm doing the Auxilium Christianorum prayers. So I also do
Oh,
those. There's
okay.
an app, and it's like almost like deliverance prayers, I guess, for the laity.
Okay. By
Not,
Father Rippinger, right?
yeah, that's a different thing, I guess. That's a book. These are just a
Okay.
group of prayers. Like often it'll have like the litany of humility on one day,
Yes,
and
because it's
then
like
it'll
Monday to
have,
Sunday.
yeah, 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 yeah. So I've been doing those.
Oh, okay. I didn't know that they had like a separate one because I have um prayers for the laity by Father Ripperger, and it like the Auxilium Christianorum is in the back of it.
Oh, okay. Yeah, yeah, yeah. There's an app. And I
Okay.
find the app is helpful because it'll just switch to the day that you're supposed to be on, and it's just easy. I have
Oh,
my phone right there, and
okay.
I scroll through the prayer on the app. Yeah.
Oh, well, thank you for telling me that. I will
Yeah, no problem.
I will do that. All right, so let's get into it. So, like, one of the reasons I wanted to have this conversation, which I'm really glad that we're having it, is that there's so many women in our community who are asking really honest questions so about fertility. And as
Mhm.
creating a NaPro medical consultants, you and I, um, so we feel like part of it is really educating, right? Because
Right.
there's a lot of misinformation, a lot of like misleading that's been happening,
Right.
and so like even us when we were training in NAPRO, we're like everyone's jaws are just like, wow, how come we weren't taught this?
Right. Yeah. I mean, I think the huge one of the biggest ones is a difference between progestin and progesterone,
Yes.
right? And I just thought birth control, had progesterone in it. But when I really looked at what progestins are,
Uh-huh.
they're a group of synthetic
Mm-hmm.
progesterones, that are more often than not testosterone derivatives,
Mm-hmm.
rather than being truly bioidentical progesterone. So
Yeah.
their molecular structure will look
Yes.
more similar to a testosterone molecule than it will to
Mm-hmm.
what natural progesterone is. And then it
Yeah.
wreaks havoc in the body,
Mm-hmm.
it can sometimes worsen, androgens like maybe facial hair or such.
Yep.
But sometimes it does there's so many different types of birth control, so it depends on which one you're talking about.
Yeah.
Um,
And so like me, like in the women's health space, like the training is, yeah, here's, it's easy, like just everything to make things easy, which is nice, right? You want to make things easy for patients and convenience, otherwise they're not gonna follow through their plan and they're not gonna be helped. But we do owe it to explain to them that hey, there's progestins and progesterones, and
right,
if you need both hormones, like in the hormone replacement space in perimenopause, I actually separate them. I give them like a separate estrogen and a separate
right,
progesterone, and I explain to them why. I said like this may be like two things, this may be inconvenient, but here's the reason why.
right. And also, there's a reason for all of that and for giving them separately too, especially like in perimenopause. I think it's helpful to do more of like a cyclic progesterone
Hmm.
because you only get progesterone after you ovulate, because
Yep.
it's only when you ovulate that you make the corpus luteum on the
Yep.
ovary, which is a temporary organ that makes
Hmm.
progesterone, right?
Yeah, so
And
like progesterone means pro gestation, so it happens after.
right, right after ovulation. That's a great way for people to remember it. And so if you know that, we're just so complex as women, and we've known this all along.
Hmm.
Have been advocating we need more research for women. We need to know more about our bodies because they're so complex. And
Hmm.
here is Dr. Hilgers, who founded NaProTechnology
Uh-huh.
and really studied and sought to understand women's bodies, which is amazing.
Yeah. Yeah, it is. It's amazing how yeah, it's beautiful. It's like whatever difficulty we experience, it's not because we're broken. It's because hey, it's our bodies signaling us and telling us like, hey, help. And there is
Right.
help. There's NAPRO.
Right. Yeah, and even ACOG realizes that the period should be a vital sign. It should be a signal
Hmm.
of health and well-being. And if
Yeah.
your period is not right, you're having a lot of pain, you're experiencing infertility,
Mhm.
that's a signal to go get medical care, especially because infertility increases your risk of cancers as well. I think we
Mhm.
forget, some people I had a patient recently, and the endometrial the endometrial thickness is like 18 millimeters, and so
Oh,
it's too thick, and she's now, I believe, postmenopausal, and
uh-huh.
she was having some spotting, and so she came to me to ask, "Well, do I really need to go see an OBGYN?" Because she was, a little bit scared, and I
Yeah.
understand, being apprehensive about medical procedures. But
Mhm.
I said, "We absolutely need to do a biopsy," and when I
Yeah.
dug into her medical history prior, to our visit and of her periods, when she was younger, she revealed that she was actually infertile, and she never sought help for that, and that,
Mm.
here we are needing to rule out cancer, and we'll see, what the biopsy eventually shows, but she never got treatment, for painful periods and infertility
Oh, wow.
when she was younger because people just weren't speaking about this,
Yeah,
like
either
we
that
are.
or I think, like, isn't it, like, a while back? And I've heard this a lot too from my patients, and I'm sorry, I didn't mean to cut you
No,
off.
no, go ahead. Yeah.
Excited. Um, that when they come to me and I ask them, like, "How long has this been happening? How come you haven't seen anyone?" I hear things like, "Well, I've been telling my
Mhm.
provider, but they told me it's normal,
Yeah,
that it's normal to
yeah.
get cramps and normal."
I mean, yes, that's another issue that I think we have. And I don't think it's the fault of the provider per se. I
No.
never was taught any of this in-depth um hormonal, balances and imbalances of the menstrual cycle. Like we went over the menstrual cycle in anatomy and physiology,
Mhm.
um in medical school, but not to the degree of like, oh, here's a standardized way to chart cervical mucus and how you can
Yeah.
understand your body more and then test appropriately
Mhm.
for the hormones. Now I feel like I have tools in my belt to actually be able to
Yes.
help.
Yeah, it's really is, like the training, and then yeah, that's why you mean you don't go to an orthopedic doctor for heart issues, right?
Right.
So you go where the specialty is, and then even the specialty, then it's part of advocating for yourself. Like, do you do this? Like, I would get calls, do you do bioidentical hormone replacement, or do you do the synthetic ones? And I'm glad that this person was versed enough that she knows the difference, because she actually
Right.
said, well, if you're going to give me progestins, I'm not going to go to you. I was like, oh girl, I don't even touch progestins, so don't worry about. But yeah, so like the education, like a lot of women are getting educated now, and this is why we have these shows, and we have these conversations. So let's
Mhm.
start with your story. So you're board certified in family medicine and obesity medicine, now in NaPro technology. So that's not a typical combination. It's a good combination. It's not typical, but it's
Yeah.
really good. So what drew you to those disciplines? How do they connect? And how do you actually care for patients today?
Yeah, so I am really interested in preventative medicine, like I originally thought I would go into sports medicine because growing up I ended up playing Division 3 volleyball in college,
Oh,
and
wow.
my mom is a dentist, my dad is a physiology professor or now retired. But like health and wellness were just kind of a part of my life, and so I really enjoyed preventative medicine. Even in medical school, I was a part of an integrative medicine club, and we did some cooking classes where food was medicine, and so
Wow.
yeah, which was really really fun. And that kind of led me, of course, to keep that interest in mind. And then in medical school, or sorry, in residency, instead of going the route of fellowship in sports medicine, I decided, well, I had my babies. I got married and I had my babies. And I said, well, I don't really want to do another year of sports, fellowship. I think I'll want to work. And one of my attendings, one of my supervising doctors said that there was an obesity medicine specialty that I could do on my own timeline, and I said, "Well, that's perfect
Mhm.
because kids make you need your own timeline for things,
Mhm. Yeah.
And so I did that. And then the NaProTechnology arose due to the need of seeing patients with menstrual issues, and due to my questioning of our current treatment approach for PCOS. I don't like that for these women with polycystic ovarian syndrome, now named PMOS, right? Um, that I don't like that they're given birth control to, prevent endometrial cancer. I get that, but I don't like the part of it where it's impairing their fertility. And then they just have to get off one medication and then go on another medication when it's time to actually get pregnant. And so
Mm-hmm.
it just feels not it feels like we're not really fixing any of the underlying problem, and we don't know all the causes
Yeah.
necessarily of PCOS. And I understand that's why we don't have, one tailored treatment per se. But
Mm-hmm.
I just felt like after learning NaProTechnology, I'm now better equipped to
Mm-hmm.
treat PCOS and really understand what's happening during
Mm-hmm.
their menstrual cycle and restore fertility
Yeah.
again, rather than just kind of, "Oh, let's cover it up, prevent endometrial cancer, and then let's,
Yeah.
withdraw and put her on Clomid or something."
Mm-hmm.
So,
Yeah. What I like see as well is that like patients would come to me and say, I've been diagnosed with PCOS. I'm like, okay, well, there's a diagnosis. What's been happening since that diagnosis, right? Like, what were your treatments? And they're like, nope, nothing. They just told me I have PCOS and come back when I'm ready to have a baby.
what?
Yeah, I've I've heard that a lot, and I was like, no, I'm glad to hear
Eh,
you.
well, and the onus goes back on us though, as physicians, as experts, to educate people, to really put that knowledge out there. And I know that, in Catholic communities, people might not want to be put on birth control pill because of their ethical concerns with birth control pill, but
Mhm,
they need to treat their PMOS or PCOS.
mhm.
They shouldn't just go with nothing because it does increase their risk of cancer. And
Yeah,
so,
there's a lot more
yeah,
complications aside from it truly needs management, like from the get-go.
right, right. So hopefully people will be able to
Yeah.
hear these things and find a good practitioner to help.
Yes, exactly. So now let's go back to the foundation. So as a physician, so
Mhm.
let's try to separate like science and faith here. Like they work well together, but like for the purpose of just laying things out in the open. As a physician, not as an advocate, um, not as an advocate, but someone who has studied human development clinically. When does life begin? And how do you
Yeah.
answer these questions for your patients?
Yeah, life begins at the moment of conception. So I hear so many times people saying, "Oh, it's a clump of cells,"
Oh,
right? And I think it's important to know the biology, right? So there's a difference between like our somatic cells, just skin cells. Nobody would have a problem with, doing a surgery or excising a tumor or whatnot.
mhm,
Um, because these are cells that, end up making up part of the body, but they're not a whole organism. So the zygote is actually a unicellular organism. And I have here a definition of an organism per the Merriam-Webster dictionary. And it's an individual constituted to carry on the activities of life by means of parts or organs, more or less separate in function, but mutually dependent. And then colon, a living being. So the the zygote at that moment of fertilization has everything that it needs to continue to divide, um, and to continue to grow and then implant, etc., in order to become, what we see ourselves as now today. We're just
mhm,
different stages of human development. And it's important to know that there's a distinction between living things and non-living things, right? So a
mhm,
rock is not alive, And we know this because it doesn't have like certain characteristics of life as well. And
Mm-hmm.
so some of those characteristics would be cellular organization, metabolism, ability to achieve and maintain homeostasis, growth and reproduction, response to stimuli, and evolutionary adaptation. And if you look at the zygote, it has everything that it needs.
Mm-hmm.
Um, I think because we're not in that space, now of course we're older, sometimes we forget that was us at one point in time.
Uh-huh. Yes, exactly. So like I just don't understand why it's so hard for people to grasp that. Like what you said makes total sense. And like for all the science, Merriam-Webster and your training, it's like
Yeah.
black and white. That's it. What like why is it why do we call it a clump of cells?
I think part of it might be misplaced compassion. I think sometimes as physicians and healthcare providers, we only see people at their worst times in their life, and when we see people um and they come to us, they're often in really challenging situations, or maybe they don't have enough money, for to care for their family or whatnot, and our hearts just bleed and break. I think most doctors really do feel compassion and they're genuinely well-meaning people. I think that compassion can then become misplaced to
Mhm.
say that, oh, instead of helping, let's reach out to the community for monetary support, aid, etc. Um, we start to think, well, maybe they shouldn't have this baby, right? Maybe the life is the problem rather than the external resources. And so I do think then it clouds judgment,
Mhm.
and that sort of fear and concern um, might not be met with a prudential decision that follows.
Yeah, that's a really compassionate way to answer it. Thank you.
Well, because I'm here in Los Angeles, Christy, and I truly, the more that I'm with people in my area, the more that these people are well-meaning people.
Mhm.
They're just for whatever reason, either maybe they don't have the knowledge, nobody
Mhm.
formed them in this, route. Maybe they've never encountered somebody with a different opinion, so they've just never thought about it.
Yeah.
Or there's a variety of reasons, but like our struggle on this earth is not with people, it's a spiritual battle. So
Yes.
the person is not the problem,
Mhm.
the to me there's a very real spiritual component, and
Yeah.
we need to still reach out in love and compassion for people.
Yeah. It's a lot more things happening in the background is and if you do realize that, yeah, it's not the person, if you almost see that person as someone who's being manipulated in some kind of way
Yeah.
to separate because divide and conquer, right?
Yeah. Yeah, and there's a war to divide us, we
Mhm.
really do need to come together, reach across the aisle, maybe even politically or, faith-wise, and just understand one another,
Mhm. Yeah.
and then always seek to tell the truth
Yes.
in a respectful way.
Yep. That's totally, yeah, totally
Yeah.
agree with that. So, one of the topics that you had mentioned on your intake is, it's really interesting. Let's talk about fetal taste.
Yes, this is cool. So there is a study that I saw a while ago talking about fetal taste. I think it was Durham University's Fetal and Neonatal Research Lab. They did these 40 ultrasound scans to look at fetuses in utero, and mom was given either a kale powder tablet or a carrot
Hmm.
tablet, and then they looked at the fetal expressions.
Oh, wow.
Which was so interesting in response to ingesting these things, and the babies were in this study were around 32 or 36 weeks in gestation.
Mhm.
However, we know that taste buds develop earlier,
Mhm.
in utero, and so but some with the kale group, can you, guess, Christy, if they were smiling or if
Oh,
they were
I'm sure they
frowning?
grimaced. I'm sure they grimaced and they're like, "Ugh."
They did. So they did. They grimaced with the kale and had little baby frowns, which were probably so
Oh.
cute. And then, with the carrots, they were happy or
Oh,
more
okay.
smiling, had like a laughter. Yeah, because carrots are generally a little sweeter, right, than the
Mhm.
bitter kale. And so
Wow.
I think that babies are perfectly made to
Mhm.
fit their environment. Oh, even towards the beginning, like I said, whenever a baby is present, it's already talking to mom. It's making HCG. It's signaling, "Hey, I'm here,"
Mhm. Oh, yeah.
and that signals the corpus luteum to
Mhm.
stay, right? Otherwise, then our body would, continue on, normally and have a
Mhm.
period. But the fact is that baby is signaling that
Mhm.
they're there in its own unique endocrine way,
Yeah.
It's maybe not talking like you and I, but
Yeah.
it's saying, "Hi, I'm here."
Yeah, and we picked it up in week 4 or 5, right?
Exactly, exactly.
Yeah. So, so there's data showing that I know we're talking about life, and we're gonna shift a little bit. So data showing that abortion disproportionately affects Black and Hispanic women and communities. So, as a physician who cares about health equity, what does that data show?
Yeah, so I don't have the research physically in front of me at the moment, but you can see that majority of Planned Parenthoods are in uh, the not so nice neighborhoods, the not so
Mm,
nice parts of town, as well, and generally speaking, more often than not, the Black and Hispanic people are seeking their services for abortion. And
mm.
that's a shame. I'm half Mexican, although I don't look it, and half white, and I really care about my Hispanic population. I often tell people I cook like I'm Mexican, but I speak, like I'm a white. I'm not fluent in Spanish, unfortunately. But
Mhm.
it is something that is very important to realize and to advocate for. If we like, I think from a biological perspective, right? I took my kids to the zoo recently. They were talking about how they were doing conservation efforts to conserve the California condor, and they went from, I believe, like 22 to now 600,
Oh,
which is
wow.
amazing, right? And how much more so are we called to conserve our own humans, our people of
Yes.
color? We want, more beautiful African American babies and Hispanic babies, and we have to realize that conservation efforts, just biologically speaking, will happen from the very, very, human sex and reproduction, right? From the biological sexual reproduction, and we're saving, turtle eggs, to
Uh-huh.
conserve our sea turtles. Like, why would we not then apply that to it's the
Humans.
same. Yeah, we're mammals, right? Why would we not apply that to humans and,
Mhm.
and advocate for them and conserve their
Yeah.
things? Yeah.
Yeah. We have a lot of animal rights protection, but like, what about humans, right?
Right, right. So it is
Yeah.
important.
So now let's talk about NaProTechnology. So for women in our audience who've never heard of it, um, what is it? How does it work? Who is it for?
Yeah, NaProTechnology just stands for Natural Procreative Technology. It was researched by Dr. Hilgers in Omaha, Nebraska, and it is really the science of treating women's health issues through these natural means, and then also using, of course, pharmaceuticals in
Mhm.
addition to, with the goal to restore fertility and to restore natural functioning
Mm.
of our menstrual cycles in the human body. And so then NaProTechnology is built upon the foundation of the Creighton model system. And that system is so amazing and unique, because it is a standardized method of charting your cycles using cervical mucus as a
Mhm.
biomarker. And through this standardized picture dictionary that Dr. Hilgers came up with and researched, really, not that he just, created it out of thin air, he researched this. Through that, you can know so much about your menstrual cycle
Yes.
and really achieve healing, which is
Mhm.
amazing.
Yeah, and I see that with my Creighton clients, and I'm blessed enough to have a younger population, and it really now I'm kind of shifting because before it's termed as fertility care, but it's not just really for fertility. It's really for
Right.
reproductive health, and the best way for a woman to learn about her reproductive health is when early 20s, I would say. I mean, if they
Yeah.
mentally they can handle it, like as soon as they get their period, right? Because we can pick up so many things at that stage, and we can educate women at that stage. And so yeah, it's just amazing.
Yeah. Women are smart,
Mhm.
and they can absolutely learn the Creighton model system. And I think
Mhm.
they will probably have a reaction similar to mine in that, like, "Where was this all along? I'm so
Yes.
blown away. I
Yep.
wish I had known this earlier,"
Mhm. Yep. Yep. Me too.
because it makes sense, and you feel like you understand who you are better, you
Mhm.
know?
Yeah, and it eliminates that fear too, because they don't know what's happening, and then they get like certain symptoms, certain types of mucus, and they freak out. But at that age, they're afraid to speak with people, right? Sort of like they they're just like, well, maybe it'll change next month, and then so like it trickles down to like how it affects them, like mentally and emotionally as well. So, what conditions does NAPRO address that conventional OBGYN care either misses entirely or manages just by putting women on birth control?
Oh, well, I feel like I need to highlight endometriosis in this talk with NaProTechnology, because not only do they do surgeries to restore the abdomen to
Mhm.
normalcy with the NaPro trained surgeons, which I am not. I'm family practice, so I will happily stay in my lane. But there are really great NaPro surgeons out there who really utilize pelvioplasty, this,
Mhm.
really in-depth surgical approach and very comprehensive surgical approach to excise all the endometriosis lesions. And
Mhm.
then not only do they do that, but they will fix underlying hormonal abnormalities that they see as well in the
Mhm.
chart. And so they do like a both and a surgical approach and a hormonal treatment, whereas
Mhm.
conventional medicine has like
The
so
standard
many
of care is different.
Yes, it's so different per which provider you go to. There are really good
Mhm.
endometriosis specialists who do the surgeries, and you do need a
Mhm.
surgery for endometriosis to excise the lesions. But then you get other people who just are not informed, and I don't know how we've been missing this as a medical organization, or when we can get, this data and these studies out to all providers, right? Because everybody should really
Mhm.
know where to
Yeah.
send their patients to
Mhm.
for this treatment, because some people will just put them on the birth control pill and say, "Okay, maybe that stops your pain a little bit." but it
Mhm.
doesn't really fix the underlying disease process that's going on. And then what's gonna happen years later when you
Yeah.
decide you wanna get pregnant, and then you struggle with infertility perhaps, and then,
It's a lot more adhesions at that point when you wait
yeah,
longer
well,
you wait.
we're just behind the 8 ball in getting the surgery done, maybe we should have had it done years prior, or it delays the time to the diagnosis.
Mhm.
So, I really like the NaProTechnology approach, and this is, the robotic, excision of the
Mhm.
endometriosis implants. They use special type of suture.
Yeah.
They take care to keep the raw edges, so they'll excise the endometriosis lesions, and then they will suture that hole that they've just created, right? And they'll
Yeah.
keep those raw edges face down, facing,
Mhm.
towards the pelvic wall rather than face up,
Mhm.
which would create more scar tissue
Yeah.
in your body. And it's just all of these little things. I was like, wow, I would have never thought of that, And, and putting a Gore-Tex membrane in the abdomen
Yes.
after they do the surgery to prevent scar tissue, because
Uh-huh.
what good is it if they do
Yes.
surgery for your endometriosis but create a lot of scar tissue? You know,
Mhm.
you people have to remember that the eggs and the tubes are not attached.
Mhm.
The ovary spits out, the egg, and your
Mhm.
little fimbriae, those are what grab it down into the tube.
Yeah.
And so pelvic adhesions and inflammation can create an environment such that maybe
Mhm.
that's not received properly, or um, the environment is not right for, fertilization or even implantation.
Yeah. So for someone who's listening, so I just want to like explain it further. So endometriosis are growths that enable your pelvic organs to stick to each other because the growths, they're kind of like cobwebs, they're adhesions, and they stick with each other. And it's really important to excise those lesions. But then the only way to excise those lesions is having surgery. And so when you do, the more surgery a person has, the more chances of adhesions because scar tissue forms, and that's your body's way of protecting itself. It forms a scar tissue.
Yes, and let me clarify one little thing. So not all endometriosis disease will have an extensive adhesions associated with it. And
Yeah.
you can also have pelvic adhesions even without endometriosis. So they
Yes.
they don't necessarily need to coexist. But there is a thought that there's possible retrograde menstruation. We're not exactly sure how
Mm-hmm.
endometriosis develops per se, but the lining of the uterus starts to deposit outside the uterus and starts to deposit on the bowel or on the
Yes.
pelvic wall, sometimes even up on the diaphragm.
Mm-hmm.
It can deposit anywhere in the abdominal cavity and cause symptoms like IBS, even bad
Mm-hmm.
constipation. Um, Really bad cramping, sometimes
Mm-hmm.
no bad cramping at all, sometimes just infertility, and somebody
Yeah.
could have a severe, endometriosis picture, or maybe even not even severe disease, like, everybody's so
Everyone's
different.
different. Yeah. And I tell my
Yeah.
patients too, like the adhesions does not correlate to the amount of pain that you're having. You could have like a tiny, you know, like adhesion and a lot of pain, but sometimes a lot of pain and then or like no pain, but then a lot of adhesions.
I would prefer the term, like, implants rather than
Implants,
adhesions.
adhesions.
Yeah,
Okay.
yeah, because the endometriosis is more like just implants, like sometimes
Mm-hmm.
even gunpowder, you'll get that if there's a gunshot, you'll see, like, spray. That's kind of
Mm-hmm.
what endometriosis sometimes can look like also in the abdominal cavity, and so it
Yeah.
is important to excise those areas
Those
of
lesions. Yeah.
yeah, yeah, of damaged tissue,
Yeah.
and also prevent adhesions in the process, right?
Mm-hmm.
Because we don't
Yeah.
want all that scar tissue.
And the reason why we're talking about how NAPRO is really amazing at addressing this is because a NAPRO trained fellow, when or surgeon, right? When
Mhm.
they do the surgery to remove the the lesions, then they have a way of preventing further adhesions from happening. So the
Mhm.
recurrence of the
Ye
endometriosis growths would be, like very minimal to like less
Yes, it
likely.
doesn't stop recurrence completely, that still is a possibility, and, but getting out the whole disease makes a significant difference in the patient's well-being and in their symptoms, and then also preventing the cobweb scarring and adhesions will allow their pelvis, not to suffer from uh, you know, sometimes these cobwebs, these adhesions can, even stick to the fallopian tube and pull it away from the ovary, right? And
Yeah,
make it such that they're not close together,
yeah,
and that can impair fertility as well.
yes,
So it
because
is
egg can't travel well, right?
right, right, right. Because yeah, exactly.
Yeah. So I do see a question on our chat. Someone who's watching on YouTube. Thank you. So they said, I've heard that there are some more studies linking the use of oral contraceptives to gynecological cancers and cervical and breast cancer.
Yeah, so cervical and breast cancer are risks of birth control. It's a small risk, and I don't have the numbers on me at the moment, but it is a recognized risk. And part of it also that I wonder is if people are using birth control as a prevention of pregnancy, are they still using condoms when they engage in intercourse or not? And if
Hmm.
they're not, because they're, no longer afraid of being pregnant, they're also at risk of HPV, right? And HPV is a big cause of cervical cancer. And
Yes.
so that could also be a component possibly to that increase.
Mhm.
And then there will be people on the other side that will say, but birth control, decreases the risk of ovarian and endometrial cancer, right? But what is the biggest cancer that one of the biggest cancers for women that we face nowadays? That's breast cancer. The incidence is way higher than ovarian and uterine or endometrial
Mhm.
cancers. And so it is important to to realize that birth control is not just everything has side effects. It's not something you
Yes.
should just take and
Mm.
oh, okay, well, I'll be fine.
Yeah,
It's
and I
some
think like women just need to be more educated that, hey, we're not hiding it from them, but like here are your options. Here's the treatment. This is birth control. There's other, either ethical or medical side effects to it versus, what other else is available. Because not everyone is, and I'm seeing this more and more now with patients. Um, like they would say, nope. Like a parent would say, oh my, she's too young for birth control. We're gonna wait. But what does that mean? That does that mean that the child should just suffer with her menstrual issues, or like what other options are there? And Creighton NaPro are excellent alternatives.
right. I would say you need something else,
Hmm.
if there is an irregularity, especially as a teen. I think back to when I was playing volleyball, okay, here in California. And I was let's go back to high school volleyball. And I remember I thought I had these shin splints and my periods were maybe a little bit more irregular. And I went to the doctor and I went to a sports medicine doctor, and I believe they did like ultrasound and they saw some like hairline fractures, in my shins. And I was essentially playing sports so much that my cycles were irregular. I was having that
Hmm.
like hypothalamic amenorrhea. And it wasn't like my periods completely went away, but I'm sure that if I had been charting at that time, I could get
Yes.
a sense of how to replenish my body better with the nutrients that
Hmm.
it needed to keep going and to be a high
Yes.
level athlete. And I
Uh-huh.
look back and now I think, "Wow, I don't think I was eating enough protein, and I don't
Yeah.
think I was really focused on my recovery after these
Mhm.
intensive workouts." And then nowadays in sports, in women's sports, we play all year round, and
Mhm.
there's not many breaks. And so it is important to know what your menstrual cycle is doing as another
Mhm.
indicator of how your health is.
Well, I love that you mentioned that, because when people think about fertility or creating, it's like, oh, unless you're trying to get pregnant, you don't need this method. But I mean, you yourself mentioned, had you known about this a while back, you could have replenished your body. It's like something so simple. And with you replenishing your body, I mean, like when people are undernourished, right? Like not enough nutrients. I mean, that can affect our moods, our energy levels, and a lot more things. And like, let's not even talk about fertility or trying to get pregnant at that point. Let's just get women functioning well.
Right, right, yeah, and I think it's I don't know, I just love that I know it now. I love that I know it now, and now that I
Mhm.
can use it and apply it to my life in this stage.
Yes, and you can share it with your patients now too.
Exactly.
Yeah. So let's now talk about, like, let's go forward with women trying to get pregnant. So for a woman who has been told that her only fertility options are just IVF or staying on the pill, so what do you want her to know, and what is actually possible for her now that she might not know about? And I think like we addressed some part of that already by talking about creating a NaPro.
So for women
So like if a
un
woman's been told
sorry,
that, it's like, hey,
go ahead.
you just gotta do IVF now.
Oh, oh, yes, yes. So, um, like there's so much more of a workup, I would say, that you will have access to if you do Creighton versus and do NaProTechnology versus
Hmm.
just going conventional IVF. One example is the IVF will do an HSG, so most women who are undergoing fertility workup will know that they got a hysterosalpingogram done where they inject dye into the uterus to check if the tubes are open or not, right?
Hmm.
But again, Dr. Hilgers has to go a step above and he recommends a selective HSG, which is to
Hmm.
aim the catheter towards one tube and inject dye and check the
Hmm.
pressures in that tube as well. So
Hmm.
regular HSG, they don't check the pressure in the whole uterus.
No.
They don't even have a value for what that should be, right? So, but Dr. Hilgers has goals of like what's normal versus
Hmm.
what's abnormal pressure in the tubes.
Yeah.
And then they could do a selective HSG to see, yes, this tube exactly is open or is it not.
Or
And
how
then this
much open is it?
exactly, or maybe there's a partial blockage in the
Yeah.
tube and then vice versa on the other side. Whereas if you just allow the dye to spill out of the
Hmm.
in the cavity of the uterus and you allow it to spill out sort of both sides, well, maybe you think it came out on both sides when you do your x-ray, but it's hard to tell because maybe the fluid kind of traveled around, to the other
Hmm.
side, the dye, and so it looked like both tubes were patent, but maybe they weren't.
Hmm.
So that's one of the things. Getting a full hormone workup is
Hmm.
another super amazing thing that Creighton will allow for, where we will do up to like 10 days of blood draws before and after ovulation, and we can pinpoint ovulation very well.
Based
Um,
on the charting.
Based off
Because
of the
everyone has to
charting,
chart first.
always the charting, don't forget. Where you can tell if there's a luteal phase deficiency or not.
Hmm.
And Dr. Hilgers goes on to characterize them as type 1, 2, 3, 4. And then I
Hmm.
believe there are maybe another one, if I'm remembering correctly.
Hmm.
Um, so we go on to characterize that and we can fix that as well.
Hmm.
Another thing that conventional IVF doctors will not be able to do is they're not able to do a cervical mucus quantifying
Yeah.
score, they're not able to score your cervical mucus, and with
No.
NaProTechnology, we do score the
Mhm.
cervical mucus. We see if it's adequate enough, if
Yeah.
it's that really stretchy, lubricative mucus,
Mhm. Yeah.
adequate enough for, allowing you to get pregnant versus not.
Mhm.
I think another cool thing with NaProTechnology, for the men out there is that, when they get told that they have low sperm counts, that's
Mhm.
really, I think, deflating to men
Mhm.
and challenging. And then the realm of IVF, can sometimes pull that sperm out per se, but if you still want the natural active intercourse, Creighton
Yes.
can still help with that by
Mhm.
fertility-focused intercourse. So
Yeah.
it can even help in the case where a man might have low sperm count to help the
Mhm.
couple to achieve still a natural pregnancy, which is
Yes.
amazing.
Yeah. It is. I mean, I I did an episode with Sister Renee a few weeks back, and Sister Renee is the bioethicist in St. Paul the Sixth Institute, and um, yeah, we talked about like all the wonderful things that NAPRO can help, and what's like what gets taken out of the equation, what's ethical, what's moral. So there's a lot more involved with with trying to get pregnant, and the success rates we had talked about that as well. And like it's cheaper. So like IVF, you're looking at like 20 something K at least, right?
Yeah,
If you want
yeah.
designer baby, you can like add, like a shopping cart, like add more thousands. And
Yeah,
I know. So yeah, but like with NAPRO, it's like I just think it. We talked about it. So like, hey, it's no brainer. It's cheaper. It's
yeah.
ethical. You just got to chart, right?
And you know what? One of my favorite parts about NaProTechnology in the Catholic space, so for the Catholics who are struggling with infertility, um, I think Catholics come to a point in that journey where they're told to get testing for the man. And for
Mhm.
all like LabCorp and Quest, they say
Here's a
in
cup.
their order, yeah, and in their orders for sperm testing, they'll say the man masturbates in the lab and then sends off his sample in the cup.
Mhm.
And then for Creighton, we don't waste the sperm.
Huh?
We allow couples to still be open to life with a
Mhm.
perforated condom. So there's
Mhm.
perforation, tiny 3 little holes to allow, the couple to still be open in life to life, while also allowing us to do science and research and see
Mhm.
if, that sample is, contains an adequate amount of sperm
Yes.
needed, etc. So I think that's such a neat, like whole
Respectful way to go. Like,
respectful way for the
yes.
whole couple to
Mhm.
still like, it's not that, "Oh, I'm Catholic, and now the Catholic Church says I can't do IVF, so woe is me, I can never get help."
Mhm.
That's far from true, especially with Creighton and NaProTechnology.
Mhm.
We built in ways, specific
Mhm.
ways to acknowledge the church's teaching
Mhm.
and to allow you to still get medical help. We
Yeah.
don't want you just languishing in sorrow.
I actually had a telemed patient on my Catholic doctor, and she's ovulating, but then she couldn't get pregnant
Mm,
for conventional medicine, and she looked for NAPRO medical consultant here in my area, and she found me, and she was saying, I just don't want to do IVF, and they told me that that's my only option, and I heard about NAPRO, and I found you, and then so I after like talking with her, we came like both of us like came to this question where, okay, so if you're being told that your only option right now is, oh yeah, because she was told like, oh, your eggs are not good quality, that's why you can't get pregnant,
mm,
you have to do IVF now, and we're thinking, and I asked her, it's like, so what is their IVF plan to help you to ovulate healthy eggs?
right.
Because if they're planning, so maybe they have other plans, but she's like, exactly, how are they going to help me ovulate healthy eggs if they're gonna um do that in vitro? So
Right.
anyway.
Well, oftentimes, like, we're taught also in medicine, evaluate what's the like, a good evaluation of ovary? Okay, it's AMH, and then
Hmm.
anti-Mullerian hormone, and we can evaluate, ovarian reserve and see if
Yes.
there's enough eggs. And but really, that should only be used in the context of IVF, and sometimes actually
Hmm.
it can help with, um, sort of predicting menopause. You can kind of see that AMH level. I believe it'll drop a little bit towards, menopause. Um, but the ACOG has a committee opinion that states you should not use AMH levels to determine if somebody can naturally get pregnant or not. And there are certain conditions, I believe even PCOS is one of them,
Hmm.
in which AMH levels can be off. And AMH levels can also
Yeah.
be off if somebody's using birth control. So if they got
Hmm.
their AMH tested while they were on birth control pill,
Yeah.
well, then your AMH levels might look falsely low
Yeah.
because the birth control is stopping your ovulation, and you might wanna repeat that later on,
Yeah.
or just go to a NaPro doctor.
I,
But
I've told some of my patients too that, like, oh, I want to test my hormones, but they're on birth control. And it's like, it's gonna be off because
yeah.
what your blood work's gonna show is what you're taking right now.
Right, right, and a lot of I think we end up just scaring women a lot in healthcare and then not giving them actual steps to follow in order to alleviate some of their concerns. I
Hmm.
think we will some of the women that I've seen are really scared that maybe they're infertile or like maybe they won't be able to get pregnant, but they haven't even started trying with their
Yeah.
partner. So and the Creighton model can be a good intermediate when you're if you're not ready to start, trying with your
Yeah.
partner, um, or you just wanna know about your health, right? Then you could do
Exactly.
starting, and that would be a really
Yeah.
good.
My Creighton supervisor actually said she has a client who's a nun,
Mm,
and this
mhm.
nun does Creighton. And yeah, I mean, it's for her personal health, and that's what
Yeah,
she's doing it for. Um, so let's talk about your children's book.
yeah.
So your book is called Loved Beyond Measure, and I love the tape measure and the baby. And so, yes, tell me about that. So what inspired it, and what did you want to give families through that book?
Well, I've now been pregnant 3 times. And so I felt, to be honest, I pregnancy is tough. And I especially in my first pregnancy without knowing what the end result is, I could see how a lot of fear can build up. Am I ready for this? And like what is it going to be like? You're like excited but also really nervous. Um and I just wanted to show people that, um I see a chat here.
Yeah.
I would just wanna show people that the babies are alive in there and that they are truly a blessing. And so in the book, we go from baby being the size of a seed, so around like 2 to 4 weeks. Can you see that? So I hired an illustrator. She did an amazing job. So to the size of a bean and heart developing. So the baby's
Mm.
holding the little heart here to the size of a grape
Oh.
and continuing on in the development of baby. And then eventually I just I end with a note, baby, still being alive here now as a newborn.
Hmm.
And then, as a little child playing. So just kind of going
Oh.
through development in the book. So I wanted to highlight and reassure women that you're made to be the mom of this baby,
Hmm.
and this little miracle is entrusted to your care, and that design. was done purposefully. You're well equipped and
Yes.
you can do it. So and to show children developing life in the womb, how this baby is alive, and
Hmm.
all of these really cool milestones that happen while it's hidden there, in the
Hmm.
uterus.
Yeah, I always love it when like when I look at ultrasounds and I see like the little heartbeat,
Yeah.
and then when you use the Doppler, you hear the heartbeat. It's amazing. And I remember um when I used to be an OR nurse, and I would see deliveries like C-sections, and
Mhm.
like soon as there's all this hustle and bustle and chaos, and then the baby's head comes out, and then that cry, and it was like, I don't know about it, it was like I was just trying to hold back my tears. It's like the miracle of life. I'm like, this is so beautiful.
It really is. I think I saw my first birth in residency, and I was just or no, in medical school, and
Hmm.
just blown away, like, it truly is amazing.
It is.
Yeah.
It is. So, for the women in our audience right now, so the ones navigating a fertility questions, grieving a diagnosis, or feeling dismissed by their provider, what do you most want them to hear today?
Oh, just that there's hope. Like I said, in medicine, I think some of the reason, like I was saying before, that doctors will recommend termination maybe for neonatal diagnoses is that they don't see your home life. Like they don't get to see the happy smiles. They don't get to see the
Mhm.
coos. They don't get to see, the love really that you form, even in the midst of maybe some trials, you know? Um, w and not all people, maybe we see them since we have specialists, maybe we see people for a small little just chunk of their pregnancy, and then
Mhm.
that's it, and sometimes in medicine, I think we can get a little bit jaded and kind of maybe even to protect ourselves, we kind of divorce the diagnosis from the person,
Yeah,
you know?
that's a very good way to say it, to put it.
So
Yeah.
so just have hope that there is beauty in every life, and the only way that we're going to solve some of these genetics or develop better medicine is to
Hmm.
have those babies with maybe disabilities so that we can study them and we can learn from them and we can grow in our medical approaches. Like now there are some wonderful doctors out there that are doing surgeries in utero. They're
Hmm.
correcting. I saw one
Yes.
the other day, I think on BBC, of a doctor fixing gastroschisis while the baby was in mom's uterus still, which is amazing. So innovation will catch up, but it'll only catch up if we have our morals in the right place, if we
Mm.
have respect for life,
Yes.
and if we just love people with all our heart. So
Hmm. Yeah, that's amazing. That's an amazing message. So thank you so much for this, Dr. Felicia. This is exactly a conversation that everyone needs to hear, not just this community. So if you are listening today, and if you want to pick up Dr. Cummings' book, it's on Amazon. I actually have a QR code if you're watching us on YouTube right now.
mhm.
Just scan the QR code and it'll take you to Amazon. She self-published it. It is called Loved Beyond Measure, and I'm waiting for my copy to get here in the next couple of days. So it's a
Awesome.
beautiful introduction talk. Like if you're trying to get pregnant right now, it's a good book for you. You can read it to your kids and then pass it on to your grandchildren. And if this conversation gave you something, please subscribe, share it with a woman who needs to hear it. And you know who she is, and you have friends. And so once again, I'm Christy Murray with Dr. Felicia Cummings, and this is the Blue Veil Wellness Show. where we talk about fate, food, and function. And we will see you next time.
Thank you so much, Christy.
You're welcome.